effect is on decreasing the activity of angiotensin converting enzyme, okay, known as ACE. Okay, and we have multiple pharmaceuticals that are ACE inhibitors. It's a whole class of medications: lisinopril, enalapril, captopril, all of these blah blah pril, P-R-I-L. Those are angiotensin converting enzyme inhibitors, ACE inhibitors. And what that does is they inhibit this angiotensin converting enzyme, which has which when inhibited allows our blood pressure to be reduced through a cascade of effects, both on our kidneys and on our peripheral vasculature. So ACE inhibitors are really important in management of hypertensive patients. It's one of our first line therapies between beta blockers and ACE inhibitors and diuretics. That's basically all of the patients that I see who have high blood pressure. They're on one of those three medications, and so it's a big mainstay of therapy for people, and really important for kidney health as well. There was research has shown that with increase in cocoa extract, you can reduce angiotensin converting enzyme, essentially creating a bit of a ACE inhibitor by virtue of using the cocoa extract. The effect is not quite as profound as you might see when you're taking an ACE inhibitor pharmaceutical like lisinopril, and so it is not meant as a substitute for that, nor is it meant if you have difficult to control blood pressure to be your mainstay of therapy. But that said, there is a very positive vasoactive effect of the cocoa extract. A randomized control study with 42 individuals showed that after 2 weeks of cocoa flavonoid extract supplementation, there was improved vascular function. So this study was done by using flow-mediated they looked at flow-mediated vasodilatation. They put a cuff around digits and arms and look at how much dilation happens in the blood vessels, and it was increased, as well as the diastolic blood pressure was decreased during that same test period. So those are some good, positive, tangible effects from supplementation of the coca flavonoids. There are other interesting effects that have also been seen in the literature, specifically with relation to the skin. There was a prospective study that was taking a look at the effect of photoaging on the breakdown of the dermal matrix of skin, and they used UVB radiation and UVB light in order to induce skin damage, and they did this on two different study type populations. One was in a petri dish, basically a human dermal fibroblast. Those are the cells that create your skin cells. Okay, so fibroblasts create skin cells, and they are underneath the matrix of your skin, constantly producing new skin cells. So they induced UVB radiation to those, and saw a protective effect of essentially the cocoa flavonoids in reducing that UVB-induced skin damage. They also looked, they took, very pathetically looking hairless mice, and they gave them these terrible sunburns from UVB radiation, and this study also showed some a protective effect and reduced wrinkle formation in those hairless mice from the UVB radiation when given cocoa extract. So those are the studies that are most representative of some of the other effects that we can see from the cocoa extract, and are interesting to talk about because these are some significantly positive effects that are associated with it.